Hello everyone, welcome to the Mana Mana Talk Show.
Where's the doctor?
Hiya.
Hey, welcome Dr. Jeremiah from Mana Doctor.
Yeah, and he's from the Internet Med. Okay, so today's topic is going to be about STD. So you all know what it's all about. Okay, so we have our doctors to answer our queries. So yeah, any questions? It will be from you.
Actually, maybe Dr. Jeremiah can share briefly on what is STD because maybe a lot of people not sure what is STD about. Maybe
Yeah,
can briefly.
Sure. So, as in STDs are sexually transmitted diseases, right? It's a very big word. Diseases sounds very scary, but it's just some health conditions that are associated with someone that is sexually active. So, part of being sexually active is being responsible for your health, right? And it's about being aware of these infections, how they can be transmitted, looking out for the signs and symptoms for these infections and getting treatment when it's necessary.
I see. Okay, thanks for the sharing. Right. So today we do have some myths and facts about STD that we wish Dr. Jeremiah can unravel all the mystery behind STD lah. Yeah. So the first thing would be during sexual intercourse, right? I mean, it's a very common act in everyone nowadays, be it youngsters or be it of a certain age. So I just want to ask, right? There's a myth saying that cleansing after sexual intercourse could prevent oneself from getting STD. Is that true?
So I guess what we're referring to is using some sort of cleaning devices, be like a tissue paper, scented soaps, or what, to clean the inside of the vagina or the inside of the anal canal after intercourse. And there's some sorts of misimpressions that can help with clearance of STDs. But there's no demonstrable evidence to show that, right? So clearing the secretions or whatever it is that's inserted through penetration doesn't help with clearing STDs. Yeah.
I see. But how about you? You have
Well, I still have another burning question. So is it true they says that before any sexual intercourse, one have to actually put on condom? So meaning to say, once wearing condom, equivalent no STD. Is it true or is it a myth? Yeah.
The point of condoms, so condoms are described as mechanical barriers, right? And they serve for two primary functions. So the first is to help decrease the incidence of STDs, and the second is for barrier contraception in people who have uteruses, not to have pregnancies. So in terms of STDs, condoms are a great way of preventing STDs, right? So in general, they decrease the incidence of multiple STDs, so things like HIV, retroviral disease, syphilis, gonorrhea, chlamydia, the whole host of them, right? Typically, people use them for penetrative intercourse, although it's also advised to use condoms for oral intercourse as well. But I think for most people, that's a bit difficult. So that's the challenge sometimes, people using that. But yeah, so condoms are a really great way of reducing the incidence of STDs.
All right, thank you, Dr. Jeremiah.
Okay.
So anything else you feel that you is like a burning question to
I
you?
heard
Yeah.
from people lah, I don't know from who lah, from my friends. They say that if you have multiple sex partner, right, then you will get STD. This one true or not?
Okay, as in their
Oh, body counts, you mean?
Yeah, body count. Higher body
yes.
counts
Body
means
counts,
higher
yeah.
chance
Is it
of
true? Is it true?
STD.
Yeah. I'm curious. Yeah.
such a big word, body counts. But yeah, as in there are multiple risk factors for STDs, and one of them is having multiple sexual partners, right? And I guess the extrapolation from that is when you're having multiple sexual partner, there's multiple chances of you getting exposed to STDs, right? I guess when I see someone in the clinic who has multiple sexual partners, I talk about things like, how are they protecting themselves, be it through condom, be it through things like pre-exposure prophylaxis, doing regular screenings as well, right? So yeah, as in all honesty, someone who takes care of themselves is probably at a reduced chance of getting an STD, or if they do get an STD, it's picked up a lot earlier and is treated a lot more quickly, right? So I think there's that end of it as well, so it's a spectrum of, we know it's a risk factor having multiple sexual partners. But if you're responsible and you're taking care of yourself through the ways I mentioned, then you should be okay.
So saying so, doctor, meaning to say if one go for general checkup regularly, they will actually prevent themselves from getting STD no matter how many body counts they have.
But we not prevent the STD, right? So I think one part of it is prevention, right? But inevitably, when having or when engaging in sexual intercourse, you're putting yourself up for risk of exposure, right? And I think that's the kind of discussions we're having, right? The first prong of protection, or the first prong of activity is protection, right? But the second part is always screening, right? Active screening, right? So someone who's sexually active, we typically advise them to come in every 3 to 6 months, depending on the frequency of their sexual intercourse, right? The nature of their sexual intercourse. And that's like a multi-pronged kind of approach to taking care of your sexual health. So that's what we do in the clinic setting, right? That's what we advise when we see patients with multiple sexual partners.
So is it something like this thing called ART, whereby they have to do a certain test, like something similar like those swab thingy? Is it true? They want anti something retrotherapy and medications kind of thing to prevent STD? Is it a fact? Is it true? Is it true? Yeah.
So ART is an acronym for antiretroviral therapy, right? And this describes medicines that are used to treat HIV. One part of having a healthy sex life is considering whether we need to use, or as a physician, talking to my patients about initiating antiretroviral therapy for things like pre-exposure prophylaxis or post-exposure prophylaxis. So all these are big words to kind of, pre-exposure prophylaxis means like, if I see a patient, they have high risk of getting things like HIV, I'll have a discussion with them about starting some medications that will protect them from getting HIV. So these are kind of discussions we have with patients who, may have a bit more higher risk. And it's part of an arsenal of things to protect ourselves, to ensure our sexual health, right? So this is on top of things like using condoms, getting tested regularly, using PrEP. So it's an entire arsenal of things to ensure your sexual health. So we don't use it just in isolation.
So is it saying so, meaning to say no sexual intercourse except for oral sex, prevent one from getting infected by STD? Is it true?
So that's actually untrue, right? I think in my clinic setting, actually, the most common places I find gonorrhea and chlamydia is in the throat more than anything else, right?
Interesting.
Yeah, and the reason for that is typically oral intercourse is typically unprotected. Oropharyngeal gonococcal disease, chlamydial disease are typically asymptomatic, or they have very mild symptoms like a bit of a sore throat, which mimics other respiratory illnesses, right? So people don't really take too much concern about it. So no, oral sex can definitely be a mode of transmission for sexual transmitted diseases, right? So the other common things that we can see will be things like herpes as well, right? When we get cold sores around the mouth or inside the mouth. So they're pretty common as well.
So is it like no symptoms, meaning what is cleared from getting STD? As in no symptoms or nothing.
So when we talk about sexually transmitted diseases, right, we always talk about the spectrum of presentations, right? And they range from things like being asymptomatic, completely asymptomatic, so meaning having no manifestations of the disease, right, to being completely symptomatic. So if we use gonorrhea, for example, right? So if you're having oropharyngeal gonorrhea, most likely you're asymptomatic. Yet no symptoms to identify as having gonorrhea, versus someone who has urethral gonococcal disease or gonococcal in the urine system, right? They might present with things like pain on passing urine, pus coming out from the genitals. So it's very obvious that they have these kinds of symptoms. And so there's this spectrum of presentations, and this applies to all the sexually transmitted diseases, right? So I think that's why we emphasize things like regular screening. And the reason for that is because there are asymptomatic infections. And with asymptomatic infections, although there is no symptoms, you are still actively able to transmit the infection. It means that you're a carrier and you can still spread the infection to other people without realizing.
I see.
Okay.
So, what is your thoughts about HPV injection? Is it good for the guys and the girls out there?
I say I'm a big fan of the HPV vaccine. I'm a big advocate for the HPV vaccine, right? So, as in, there are several vaccines which protects against 9 common serotypes of the HPV virus, right? So, the HPV vaccine is one of the only kind of vaccines that protects against cancers, essentially, right? It protects against cancers as well as things like anal or vaginal growths, these kinds of things like the papillomas. But yeah, it's one of the vaccine that's used that can prevent cancers, be it cervical cancer or anal cancer or oral cancers, depending on where the HPV virus is residing, right? And so it's a great tool in keeping yourself sexually active but also healthy.
I see.
I see.
So, have any burning question?
Let's say for
Anything else?
example, if touch wood, I get STD, is it curable, or I do have to live it with the rest of my life or something like that? You know, that's something that I feel like a lot of people want to ask but are afraid to ask. Yeah, so maybe can have Dr. Jeremiah to talk about this. Is it
Yeah.
curable?
Oh, yeah.
Is it curable?
And would it actually pass to the next coming partner or whatever?
Yeah.
Well, it depends on the sexually transmitted diseases, right?
Yes.
So there are diseases which are curable, and there are diseases which are not curable but manageable, right? So things like gonorrhea, chlamydia, syphilis, bacterial vaginosis, these kinds of things we can treat typically with oral antibiotics, right?